Hello and welcome to Right Decisions, a show designed to give you tools and strategies to be successful in life. I'm Tammy Moore Johnson, your host. It is indeed my pleasure to bring this show to you every week. Today we're looking at women's health. What are some of the top women's health risks? Why do some women have severe premenstrual syndrome? Why is heart disease the #1 cause of deaths for women? And what can we do to prevent it? Why do so many women suffer from depression? Here to help me discuss today's topic, women's health, is Dr. Jennifer Reisinger. Dr. Reisinger is an obstetrician, gynecologist, OBGYN, in Columbia, South Carolina, and she is affiliated with Palmetto Health. Welcome, Dr. Reisinger, and thank you so much for being here.
Well, thank you, Tammy, for having me. I'm really excited to have an opportunity to talk about something that's very important to me, which is women's health.
Oh, absolutely. So let's just jump right in and talk about something that makes the difference, makes us women. Let's talk about our menstrual cycle.
Yes. Yeah. So from the time we start our cycle and then we start having this bleeding that happens every month, you know, that's really one of the magical things that our body does, because it's something that only we can do, which is create new life.
Yes.
And so, but with that comes some of the down things. We have this wonderful thing, creating new life, but it comes with the negative things of breast tenderness, bloating, bleeding, and some of the other discomfort that comes along with that.
Right. So it's normal to have some bloating and some tenderness in the breast, or is that showing that something's lacking in perhaps a woman's diet?
Yeah.
You know, is that normal?
Yeah. So some of the breast tenderness and discomfort right before your cycle is very normal. It's related to one of the hormones that we make, which is called progesterone. And that hormone is very important because that's very important in helping to sustain a pregnancy. However, it's probably the culprit in the bloating and the water retention and that breast tenderness. And for some women, the moodiness too that goes along with having your cycle.
So if it's normal, should we try to fight having the bloating, you know, taking things to make us not bloating? What should we do?
Well, I like to minimize things as natural as possible, and there are some natural things you can do. Certainly drinking a lot of water, eating a very, very healthy diet with lots of good fruits and vegetables, low fat, and then that regular exercise can also help with some of those physical symptoms. So those would probably be the things I would say to help. Other things like over-the-counter non-steroidals such as Motrin or Advil, Aleve, that helps with some of the minor aches and pains that we experience.
And you said a good diet can help with that, and it's so funny because you crave sometimes the wrong stuff.
You crave those carbs, you crave that salt and things like that, when really what your body needs are the healthy things. So all the fruits and vegetables that you can eat, as opposed to trying to avoid the potato chips and the ice cream and the things that your body is craving.
It makes you feel so much better.
It does make you feel better. But actually what would be even better than that and releases the same hormones that eating those carbs do would be going for a 20-minute walk.
Get out of here, good.
That does. It releases those same natural endorphins that happens when we eat those carbs. Just going for a 20-30-minute walk will also help to alleviate that.
So you feel better. You won't have necessarily cramping, or is it just the bloating that you're referencing?
Yeah, no, I think the physical exercise will relieve some of the physical symptoms, and it relieves a lot of the emotional symptoms as well. Yeah,
let's talk about some of the emotional symptoms that may go through a menstrual cycle. Is this normal, or is it, why does this happen?
Yeah, well, it affects every woman differently. For some women, it's very, very minimal, and maybe they might just be a little bit more irritable and maybe take things differently during that week right before their cycle than they normally would. But for some women, it's very incapacitating to the point where they really find it difficult to just get through their day. They really find themselves withdrawing, lashing out, being very angry, sometimes listening to a song on the radio and just bursting into tears for no reason. So it's a very much of a time of emotional lability. And that seems to be related to an imbalance in of a hormone in our brain that's called serotonin. That regular exercise will help to stabilize the serotonin, as will eating very healthy foods. So that would be something that's what's causing it. And every woman is a little bit different.
So is it a case where a woman you said every woman is different.
Right.
So the ones that have it more severe, at what point should they try to get just psychological help, or what do you advise?
Well, I always think if it's interfering with your getting through daily activities, so if it's starting to affect work, if it's starting to affect home, it's really starting to affect what you're doing and you getting through your day, that's definitely a time to reach out to your doctor or your healthcare professional to say, I'm having trouble with this. If you're already trying those over-the-counter things, you're already trying to eat healthy and exercise, and you're still having severe symptoms, then there are some wonderful medications that can also help, but that's something that you'll need to discuss with your doctor.
Now, and we kind of talked about before the camera that this is a modern day for women, because in the 20s or 30s or what have you, 1920s, 1930s,
that's right.
that you were saying that women typically would not live as long.
That's right. The most dangerous thing we could do as a woman would be to have a child. So many of us would die from complications from childbirth. So what we're finding with PMS and menopause is really a modern day problem for us. And so we're really trying to figure out what is the basic physiology, and more importantly, how can we help women in this time of transition.
Let's go to menopause. You mentioned that. So start with defining, exactly what menopause is, the typical age, and what can we expect?
Right. So menopause, by definition, is when you go 1 year without having any regular cycle.
Okay.
So for most women in the United States, that's about age 51. There's this transition period that could be from a few months to a few years called the perimenopause, when the cycles start to change. They're not as regular. They're not as heavy. Sometimes they're heavier. You start to have some of the symptoms of the hot flashes, start to see signs of the hormonal imbalance as the quality of our eggs are decreasing and as we're running out of eggs, and then finally we stop having regular cycles. So for most women, that period of months to years is a very uncomfortable one. But once you go a whole year, you're now menopause. You're now in menopause, which is really a state of lower estrogen. It's a state of low progesterone. And you start to see our body have a balance shift of more testosterone and less of the estrogen. And that's when we start to see our rise in heart disease, the rise in the cholesterol, and then also that, you talk about the shift in the fat going from our hips to our tummy, all that starts to happen, and that's what's happened is the estrogen. Well, as the estrogen-testosterone ratio changes, and the testosterone becomes more predominant and estrogen decreases, then that's when we start to see this shift.
So we can't get away from not exercising, basically.
That's right. Eating healthy and exercise is something we have to do every day, because that's
it's just going to get worse as we get older. It's going to just all go towards the middle.
Where we don't want it to go. That's right.
That's right.
But that's what puts men at higher risk for heart disease as well, is that higher testosterone ratio. So for us, when we're having our cycles, we're actually protected. Estrogen is protecting us a little bit.
Okay.
We really start to see an increase in our heart disease risk as our estrogen levels go down. The testosterone our body's naturally producing in a small amount starts to increase. Then we really start to see our heart disease risk go up. So normally heart disease you will see develop in women later, whereas men are getting it in their 40s and 50s. Women develop it in their 50s and 60s and 70s.
Because of the hormonal.
Because of that hormonal shift.
Wow. So what should they be doing? Should they take some hormones to help regulate that shifting, or I know we said natural exercising and eating diet, because there's some of this they can get through their diet. But if they were to do more preventive, what are some things that they could do to prevent to help that shift that's going to happen?
Well, I wish I could tell you estrogen was the answer to everything.
Okay.
But as you know, some of the studies are showing estrogen may not be our friend in all things. We do worry about our increased risk for clotting. We worry about increased risk for breast cancer. So not all women will benefit from hormone replacement.
Gotcha.
A lot of women will. But what we try to do in our practices is to really just treat those symptoms and to make sure that we're addressing what that individual woman's needs are. So for some women, hormone replacement is something that's beneficial. We try to limit it to the lowest dose for the shortest period of time.
Okay.
But for some women, the benefits far outweigh the risk.
Okay. Well,
there are other women who have maybe a strong family history for breast cancer and or a personal history of breast cancer, and for them, hormone replacement is not the answer. So we really want to tailor it to her specific needs.
I like the way you said that. Let's take a break, and then we'll pick up right here when we come back.
Great. Thank you.
We'll be right back.
If you keep tanning, indoors or out, the effects of harmful rays will show up on your skin. Wrinkles, age spots, and an increased risk of melanoma, the second most common cancer in women 15 to 29. Stop tanning. Time may not be on your side. Learn how to protect your skin at spotskincancer.org. A message from the American Academy of Dermatology.
You may have an event that you would like to announce, or if you are a business that would like to get your information to the public, consider advertising with Right Decisions. Right Decisions is aired on the Fox network in the following counties: Richland, Calhoun, Lexington, Fairfield, Kershaw, Saluda, Lee, Sumter, Clarendon, Orangeburg, and Newberry. That's a total of 11 counties that can hear your message. Beyond reasonable rates and wide market opportunity, help impact the communities with a premise to make right decisions by supporting the program's platform. For more information, call 803-348-6517.
Welcome back to Right Decisions. We're talking about women's health today. Dr. Reisinger, before you left, we left for the break, we were talking about the hormonal therapy.
Right.
There's some of the replacement they can do. Can you finish talking about that?
Absolutely. So whenever I see someone who's in that perimenopause or menopausal time, each year we kind of do an inventory of terms of how she's feeling, any side effects or any symptoms that she's experiencing, and then we really try to tailor her therapy to what's going on in her life. You know, some years the answer is, hey, I'm doing great. I'm enjoying how I'm feeling. Hot flashes are minimal. I've got great energy, and we continue hormone replacement. Usually after we've been on hormones for about 5 years, then we start to really have the tough talk about it's time to come off if we can, because I really don't want to increase her risk for breast cancer without doing that. So it's a year-by-year decision. It's seeing where she is at that point in her life, and then we do try to wean off to either nothing or as natural as we can after about 5 years.
And the hormonal replacement is not for everybody.
It is absolutely not for everybody. It's a
something.
That's right. It's a personal decision that I really would encourage each woman to have with their healthcare provider.
Absolutely, very good. So let's go back to the menstrual stages.
Yes.
Let's go to now we were talking about the 50 and 60s. Let's go. What are some typical things that maybe women in the 40s will experience dealing with menstrual cycles?
So 40s is the time of change. It's a time of transition for us. Many of us have children who are growing and leaving the house, flying from the nest. It's also a time where we start to experience those hormone fluctuations in probably a much wider range, mostly because as we get older, the quality of our eggs isn't as much. And so the quality of our cycles isn't as much, and we have a lot more fluctuation. The other thing that we still have to be very conscious of is we are still in our very fertile time. And so, you know, having those conversations as to this is where I am in life, this is what I'm experiencing, what should I be doing? So the other thing about our 40s is that's time of rising risk for high blood pressure, diabetes, cholesterol, and so that's also a time that we really need to be seeing our physicians and our healthcare providers on at least an every other year basis to get your blood pressure checked, to get your cholesterol checked, really assess what is my risk personally for heart disease, stroke, diabetes, and really trying to be proactive and keep those numbers in the ideal range to actually prevent any long-term damage that might occur when we're in our 50s, 60s, and 70s.
Now that's important. You mentioned about those numbers and cholesterols, and women need to know that they are like 3 particular with the cholesterols, like the LDL. Can you speak about that and what those numbers that they should be looking for with that?
I think the numbers that we look at are the total cholesterol, which ideally we like to see less than 200. You have your HDL, which is the good cholesterol, and ideally we want to see that over 50. And you can actually increase your HDL by exercising, eating healthy, and so we want the HDL to be as high as possible. And then the final one is the LDL, which is the bad cholesterol, and ideally you want that to be as low as possible. So those are the 3 numbers: your total cholesterol, your HDL, which is the good cholesterol, and the LDL, which is the bad cholesterol.
Now, when they go for a physical, normal checkup annually, is that typically done at that time?
Yes.
Or they have to request that?
Well, I think typically if you're seeing your healthcare provider, they will kind of have a running list, and the question should be, when was the last time we checked your cholesterol? For the most part, if someone is healthy and their numbers are normal, you're going to want to check that every 2 to 5 years. If you actually have elevated levels and we're actively trying to decrease those numbers with diet, with exercise, perhaps with medications, then they may want to check it on a more frequent basis.
And so this is beginning in your 40s?
This is actually beginning in your 20s.
In your 20s,
yeah,
okay.
But definitely in your 40s, that's definitely a time that you want to be getting with your healthcare provider on a regular basis, knowing what those numbers are, and actively managing them.
Yeah. Now, did we address night sweats? We didn't do that with the menopause, did we? Yeah, let's go back to that and talk about the night. There's so many different things that women are experiencing in their 20s, 30s, 40s, 50s, 60s that I'm going to try to pull them all in at different times here. But let's talk about night sweats.
is a something a woman experiences when they're sleeping normally, and then all of a sudden they wake up and they've completely broken out from head to toe in a sweat. And typically it's bad enough that you even have to change your nightgown and or the sheets. And so you kind of get to the point where in the world is this coming? It's just like you just stepped out of the shower. And that can be caused by many reasons.
Yes.
I think first and foremost we do blame hormones, because a drop in the estrogen level can trigger those hot flashes. There's a little thermostat in our brain that if that estrogen level drops below a certain level, it triggers those hot flashes. However, people have the night sweats. They can also occur during the day. And so number one is hormones. Other things can cause it though. I always worry about other things like other medical conditions, say chronic infections. Some women have autoimmune diseases such as lupus or sarcoid. Those can also cause the hot flashes and night sweats. And then the other thing is other chemicals, and most commonly a glass of wine. For some women are very sensitive to alcohol, so a glass of wine or an alcoholic beverage can sometimes trigger a hot flash as well. So hormones get blamed, and rightly, probably because they're the most common, but don't forget there's other reasons too. So if you're really experiencing severe night sweats that are affecting your quality of sleep, which is where most of the symptoms come from, waking up 2 or 3 times a night, changing your sheets, that needs to be discussed with your healthcare provider.
Absolutely, that's good. So let's talk about sex during these different age periods here.
Let's talk about that.
Yeah.
So there's several reasons why a woman could be experiencing some difficulties with sexual function during her 40s, and certainly in the menopause. Some of it is the stress that we're under. So a lot of the sexual dysfunctions we see is situational. There's stuff going on with kids, there's stuff going on at work, you're exhausted, and then the last thing you want to do when you fall into bed at night is to be intimate. Is you just want to sleep, right? So, and then the other thing are the physical changes that happen to our body. Once we go through the menopause, we're in the perimenopause, and our estrogen levels decrease, we do have some thinning and some changes that happen physically to our body. The tissue gets thinner, it becomes less pliable and less elastic, so intercourse becomes more painful, there's more dryness, and that becomes more painful, and so there's some physical things that we need to address as well. And if that's something that is affecting a woman in her relationship, then that needs to be discussed with the healthcare provider, because there are some options that are hormonal that will help, as well as some other non-hormonal options that we can look at.
Is there something that they could do for diet for that, or no?
I would not say necessarily diet. I think it's more dealing with the issues of dealing with more what are some of the topical lubricants we can use.
Okay.
This is a great time that hormone replacement topically can be looked at, which is I think a little bit lower risk than systemic therapy, because this is a quality of life issue for a lot of women. It's one that a lot of us don't talk about, but for me this is a deal breaker for many folks, and this is where a lot of relationships really struggle. And so I would encourage women to really talk to their healthcare provider, because there's things we can do to make that part better.
Very good. Yeah. Okay, I'm going to take another break, and when we come back, we're going to talk about some of those health concerns, the illnesses or disease that are killing women. Okay?
Absolutely.
All right, we'll be right back.
No. Pain. Oh, is that my heart? My heart. My heart? No, it'll pass. 911. Could call 911. No, ambulance. Couldn't do that. Sirens. Neighbors rushing over. Embarrassing. Too embarrassing. Maybe I'll feel better later. Oh.
Some people would rather die than call an ambulance. So that's exactly what they do.
You may have an event that you would like to announce, or if you are a business that would like to get your information to the public, consider advertising with Right Decisions. Right Decisions is aired on the Fox network in the following counties: Richland, Calhoun, Lexington, Fairfield, Kershaw, Saluda, Lee, Sumter, Clarendon, Orangeburg, and Newberry. That's a total of 11 counties that can hear your message. Beyond reasonable rates and wide market opportunity, help impact the communities with a premise to make right decisions by supporting the program's platform. For more information, call 803-348-6517.
Welcome back to Right Decisions. We're talking about women's health today. So before we left from the break, we said we're going to come back and talk about some of those diseases that women are dealing with, the top 5 health concerns for women. We hit heart disease just a little bit, but let's just
I do think another one goes right along with heart disease is stroke. I think that also it's, we think about a heart attack. Well, a stroke is a brain attack. The same process that's happening during a heart attack is the same process that happens in our brain. Flow is disrupted. Very crucial parts of our brain don't receive very crucial oxygen, and part of that brain dies. And so when you think about that, stroke is probably the other thing I really worry about, just because of the devastating effects it can have in a woman's life. I think the other ones that I worry about are diabetes, because we certainly see in South Carolina rising risk for diabetes, increased diabetes, as well as bone health and osteoporosis. I think people sometimes don't appreciate the devastating effects of osteoporosis and what a fall and a hip fracture does for us. When someone falls and breaks a hip, 1 in 4 women will actually die within the next year.
Oh no.
Yeah, 1 in 4 will end up in a nursing home and will not be able to return back to their usual quality of life.
Well, let me ask you this. What can they do to prevent some of this bone loss? Or, is it, again, I'll go back to nutrition.
That's right. Well, number 1 is nutrition, and we have to build our peak bone mass and our peak bone density in our teens and 20s. And so making sure that our young girls are getting the calcium that they need and the physical exercise that they need, so their bone density can go to its peak, and it probably peaks, say, in our late 20s. And then from there it starts to kind of stabilize, and then once we hit menopause with that lack of estrogen, we actually start to break down bone much more quickly than we're building it up. And so that's some menopause on is when we really start to see that increased risk for osteoporosis. So family history, smoking, poor nutrition, and actually, being very underweight is a risk factor. So if someone is actually very, very underweight with a low BMI, is an increased risk for osteoporosis as well.
But you say that your teenagers in their 20s, that's when we need to be making sure they're getting enough so that it can, when they get older, they have good bone density.
Absolutely. That's when they're building their bone mass, and so it's our teenagers. And unfortunately, the cheese on the pizza doesn't count. So we really need to make sure that they're getting their calcium, whether it's yogurt, whether it's milk. Sometimes just having a couple Tums a day, that will actually get their bone mass up.
That's good. That's good. I appreciate that. So, and then what are the? Did we hit breast cancer?
Breast cancer. Yeah, that's on my top 5 list. And I think certainly women are very aware of breast cancer risk, and it's now to the point where it affects almost 1 in 8 of us. And I don't think there's any woman out there in South Carolina today who does not know some family that's been affected by breast cancer. I will say that I think our screening is becoming more effective. Lots of wonderful things on the horizon, and we're identifying breast cancers earlier, and we're developing more effective treatments so that breast cancer today doesn't have to necessarily be a death sentence, but it is something that many, many women face. And so I usually recommend starting screening mammograms in the 40s. I do think it needs to be done yearly in the 50s. And if you've got a strong family history, you need to talk to your healthcare provider, because your screening recommendations might be different than a low-risk population.
What are some preventive for, with breast cancer? Because we always go back to diet.
Diet, exercise are always the top 2. The other things that I think some people may not appreciate is breastfeeding your children will decrease your risk. If you can have your first child by 30, that seems to be a protective effect. But once again, I think the hallmarks are exercise, healthy diet, breastfeeding if you can, and are probably our biggest areas of prevention. And
then autoimmune diseases, you see
autoimmune diseases I think affect women as well. And I think of autoimmune diseases, everything from lupus to rheumatoid arthritis to sarcoid. And those are kind of where the body starts to attack itself. And women do seem to be a little bit higher risk for some of those issues. And those will start to affect us in our 40s as well.
I was going to ask you with the age span. And what about for breast cancer? I know you said they start screening.
We start screening at 40s, but really our biggest risk is age, which we can't control that clock. So most women will develop cancer over the later years of their lifetime. Much more rare to develop breast cancer before you go through menopause. After we go through menopause, that risk does increase.
Oh, wow. Okay.
But lifetime risk is 1 in 8, lifetime risk.
1 in 8, yeah. So is there any other particular health concern that we need to mention to the viewers?
I think those would be my top 5. I worry about heart disease, stroke. We do talk about diabetes. Did we talk about diabetes?
No, we didn't.
That's on the list.
Let's do that.
So let's
Yeah.
talk about diabetes.
That's right.
And diabetes for a lot of us too is increasing as we see that our weight is increasing. I think for most people they have a set point. And for us as women, I think it's also hormonally mediated. You know, women who have had diabetes during pregnancy, which is a common thing that happens in relation to the pregnancy hormone, they have about a 60 to 70% chance of developing overt diabetes. Usually it's that type 2 diabetes as they get older. So that would tell us that there's something in our genes that when we're pregnant, that little diabetes high sugar gene gets turned on. And so those women are especially vulnerable to high sugar. If we have diabetes, that sets up another cascade of problems where cholesterol changes. It can cause more damage more easily to our blood vessels, which increases greatly your risk for heart disease and stroke. And so diabetes is one of those other modifiable risk factors, I think, that if we can get sugars in good control, diet and exercise important there, will minimize your risk for heart disease and stroke.
Did you say it was a certain age that you see an increase in diabetes? Is it being
We do start to
identified
see
in
it
the 40s?
as
or?
our older, well, we actually are starting to see it now in our teenagers.
Oh my goodness.
As childhood obesity is increasing, it's not unusual to see diabetes being diagnosed for kids in their teens. For me, as an obstetrician, I see a lot of women who develop diabetes just in the incidence of pregnancy, which is temporary, and once they deliver and the pregnancy hormones return to normal, the diabetes goes away. But that woman is at much higher risk for developing overt diabetes as she gets older in her 50s, 60s, and 70s.
Oh, wow. And our time is up. My goodness, I really enjoyed talking with you about this crucial topic.
Well, I have so enjoyed it.
Yeah, if they want to contact you, you're at Park Ridge, or can you tell them how they can get in contact with your practice?
So I would say if you go on the palmettohealth.org website, there is a wonderful little link that says, find a doctor. And you can click on that and then be connected with any of the wonderful physicians and advanced practice nurses who are at Palmetto Health.
Absolutely. Thank you so much.
Thank
Dr.
you.
Reisman.
Thanks for having me.
The biggest threats to women's health are often preventable. Most issues or concerns regarding women's health can be improved by lifestyle and diet. It has been our objective today to share strategies to obtain a longer, healthier life. We want to leave you with tools to make your life easier and more successful. At Right Decisions, we just don't want you to prosper here on earth. We want you to prosper eternally as well. There's no right decision without making the best and ultimate decision of all times. That is making Jesus Christ your Lord. If you do not know Christ as your Lord and personal Savior, I encourage you to do so right now. Just simply believe with your heart that Jesus died for your sins and confess out loud Jesus is your Lord and Savior. Now when Christ returns, you'll be able to join him. Thank you so much for tuning in to Right Decision, a show with a positive message. If you'd like to contact me, email me at tuesdetomakerightdecision@gmail.com. Have a wonderful week, and we'll see you next Sunday. Goodbye for now.